Telling patients to stop taking antibiotics when they feel better may be preferable to instructing them to finish the course, according to a group of experts who argue that the rule, long embedded in the minds of doctors and the public, is wrong and should be overturned. Patients have traditionally been told that they must complete courses of antibiotics, the theory being that taking too few tablets will allow the bacteria causing their disease to mutate and become resistant to the drug. But Martin Llewellyn, a professor in infectious diseases at Brighton and Sussex Medical School, and colleagues claim that this is not the case. In an analysis in the British Medical Journal, the experts say the idea that stopping antibiotic treatment early encourages antibiotic resistance is not supported by evidence, while taking antibiotics for longer than necessary increases the risk of resistance. Without action on antibiotics, medicine will return to the Dark Ages, Ed Whiting-Reed. There are some diseases where the bug can become resistant if the drugs are not taken for long enough. The most obvious example is tuberculosis, they say, but most of the bacteria that cause people to become ill are found on everybody's hands in the community, causing no harm, such as E. coli and Staphylococcus aureus. People fall ill only when the bug gets into the bloodstream or the gut. The longer such bacteria are exposed to antibiotics, the more likely it is that resistance will develop. The experts say there has been too little research into the ideal length of a course of antibiotics, which is also varies from one individual to the next, depending in part on what antibiotics they have taken in the past. In hospital, patients can be tested to work out when to stop the drugs. Outside hospital, where repeated testing may not be feasible, patients might be best advised to stop treatment when they feel better. They say that they add is in direct contravention of World Health Organization advice. Other experts in infectious diseases back the group. I have always thought it to be illogical to say that stopping antibiotic treatment early promotes the emergence of drug-resistant organisms, said Peter Openshaw, president of the British Society for Immunology.